First of all, I'd like to welcome everybody and to this session and Tank Talk. My name is James Tyson. I'm from the Centers for Disease Control and Prevention. And at that location, I am the chief of the Situational Awareness branch in the Division of Emergency Operations. And I work with a group of public health scientists, knowledge management experts, information technologists, and geospatial analysts. And what we do is we try to basically take data to information to knowledge for the scientists at CDC in order to provide them decision-generating capability. Before we get started, I'd just like to say that for this session is really not for us to just inform you, but it's going to be totally dynamic. So any point in the discussion, if you have a question, we want to hear what you have to say. And in fact, we hope to be informed by the folks, the experts in the audience, on some of the concepts as well as technologies that we'll be discussing so that we can both learn from each other. So just raise your hand at any time, and the questions that you ask, we can have them addressed by my esteemed colleagues up here. So to get going, what I'd like to do is go ahead and start with Dan. They're going to provide you with who they are, where they're from, and their backgrounds, and then I'll provide the overall concept and vision of this thing called Operation Dragonfire, and then talk about the technology integration and capacities that we're trying to do through a few graphics to elicit discussion and follow on. So Dan?
Thank you. Good morning. I am the president and CEO for what the government calls NVOAD. Most of other organizations call it National VOAD, but it's actually National Voluntary Organizations Active in Disaster. It's a consortium. We're an NGO, and it's a consortium of all of the major organizations in the United States that provide disaster services throughout the disaster cycle. And you have organizations like the American Red Cross, Salvation Army, Feeding America, the whole network of food banks in America. All these organizations get together and coordinate. It also is made up, the collaborative is made up of 55 state and territory collaborative of many hundreds of other organizations throughout America that all work together and aspire to find solutions to overcome the challenges of disaster. And we work very closely with government officials, and in the National VOAD headquarters itself, we particularly work on coordination with the federal system.
Okay, and then we'll go to Dr. Andreaitis.
Good morning. My name is Joanne Andreaitis. I am also from the Centers for Disease Control and Prevention. As many of you, I'm sure, know, CDC is an operating division within the Department of Health and Human Services. We look at ourselves a bit as a knowledge-based organization that works very hard to protect the health of people here in the U.S. as well as people internationally. In my current role, I'm a senior advisor for laboratory preparedness in the Office of Public Health Preparedness and Response. And so what all that means is I work with a group of people who try to think very carefully about how we can work with state and local jurisdictions and international entities to ensure we're very aware of what the current threat risk looks like, how we can best prepare to meet those threats should they occur. And part of my work is to provide strategic oversight to a portfolio of research and development activities to help us do that. But one thing that we're very interested in always is looking for bigger, better, more effective ways of protecting health.
And now we'll go to Dr. Havasi.
So hello, everybody. Good morning. I'm Catherine Havasi. I'm with Luminoso. We are an unstructured data analytics provider. So what we do is we help people make sense of large quantities of usually text data. So it could be from anywhere. So it can be from everything from scientific papers all the way to people talking in social. So I'm a data scientist, and a little bit of background on what I do is I used to teach data science at MIT. I'm on leave right now to work at this company that came out from the work that we do here. So we do general unstructured text analytics, but it specializes automatically to particular domains. So somewhere along the last couple of years, we realized that we really had an interesting perspective on the health domain, because when you're listening to actual people talk about their health, they often don't get the names for things right, they often don't get the information right, things like that. So if you have a dynamic system, it needs to be able to learn and adapt to the way people talk about health, to the changing vocabularies both within the scientific community and within the patient community, be able to understand all of that. So that's a little bit where we come into things.
And now we'll move on to the American Red Cross. Wendy?
Thank you. Hi, I'm Wendy Harmon from the American Red Cross. I was a part of building our Digital Operations Center, which opened in March of 2012, which is a physical space that visualizes social media data around disaster scenario, any sort of emergency event, or really anything. The DigiDoc does a couple of things pretty well. It's allowed us to really incorporate a real-time situational awareness, looking at big data trends and big topics of conversation. It's allowed us to get into the weeds a little bit with individual needs, routing, and alerting us to where new needs are arising that we maybe haven't covered yet in a response situation. And we're also able to do a lot more engagement through the center. So we've developed a digital volunteer role that allows lots and lots of people to, on behalf of the Red Cross, reach out and provide preparedness tips and just talk with people who are in emergency situations. I'm now, have in the last couple of months switched to a new role as the Director of Information Management and Situational Awareness, which takes a long time to say. And there, in this role, I'm really trying to, and I'm excited about figuring out how to incorporate this unstructured data, whether it comes from social or not, into the relief operation and the way that we're structured as an organization. Most interested in really community resiliency and how data can drive people to be inspired to take precautionary measures so that they will be ready for anything that might happen. So looking forward to talking.
Okay, well, thank you. Now I'll take a few minutes to kind of set the stage, provide the concept of Operation Dragonfire. So Operation Dragonfire, from the big picture perspective, is about developing a participatory crisis management or public health information sharing, collaboration, and dynamic analysis and assessment capability that allows people to share, people with people and people with information anywhere, anytime, and any place using current, enabling technologies. Most of those technologies with internet from a systems technical and operational perspective, internet enabling technologies as well as mobile technologies. The intent, one of the major intents of Operation Dragonfire is to really leverage technology to help us in sharing, or how we share collective information amongst all the stakeholders that would be involved at the local level, to the operational, to the strategic level during major crisis response or a public health incident of national or international concern. But more importantly, it's not just about leveraging collective sharing, but how do we leverage collective analysis as well as once we get to knowledge, how do we share that collective knowledge during the event to move us from legacy information that is non-real time closer to near real time, and in some cases real time, in order to protect and perform mitigation actions in order to negate any poor outcomes. So a couple of the objectives that some of the panelists talked about here was that a few of the major objectives, I'm sure many of you are working, is we're wanting to integrate technological capabilities to correlate and in some cases fuse what we call gold standard, silver standard, and bronze standard information. From our perspective at CDC, the gold standard information is traditional biosurveillance data, scientific data, most of which is verified and validated. The problem with that is a lot of that verification and validation takes a lot of time, so it's non-real time, syndromic, which if you wait, you're in the non-real time, and during the time that you lose, you can't take those appropriate actions to prevent those poor outcomes. So we're looking at that silver standard. In today's technology, the services, service-oriented architectures with verified and validated centers of excellence to provide or get services and data and information from them and correlate that with our gold standard information, multiple metadata layers. And then lastly, with some of the work MIT and the folks up here have been looking at, the unstructured universe is huge. And for the most part, a lot of noise, you know, the signal to noise out there is really tough to mine that data. But if we can figure out ways to use technologies that we'll talk about, like semantic processing for to derive contextual information associated with the verified, validated gold, silver standard, and then that bronze level standard data, we'll be better able to integrate, and through the synergy of all of that information and through the dynamic abilities to visualize, compare, contrast, we'll move from just situation awareness, providing status, to situational assessment and analysis to provide recommendations, provide possible, what we need to be looking at and what we need to be doing to get ahead of the problem or the situation. So, operational concept. Using this as a means to kind of elicit what we're talking about, imagine any kind of emergency in the middle. Leveraging today's ubiquitous computing, mobile computing, and ubiquitous computing capacity of crowdsourcing, social media, first responders, and from the perspective of digital government and whole of community, there's a lot of folks out there that are going to be able to provide you, in the sense of crowdsourcing, really some accurate and verifiable information that we can use. And whether it's social media or crowdsource, they're using applications up in the top right-hand corner to disseminate that information, true or not true. So what we're looking for in where the golden retriever is a trusted site or a technology partner or partners that can provide three major types of technologies: deduplication, algorithms and technology, geolocation, spatial temporal geolocation technologies, and semantic processing in order to get that signal high and that noise a lot lower so that we can correlate and fuse this information in a way that at the bottom it can be geospatially and temporally displayed for the folks doing the planning, the folks trying to assess the situation in order to move from assessment to that analysis and predictive value. And at the same time, that geospatial and the products, the amplifying information that we gather, need to be able to be transparent, again, digital government, secure, and permission-wise provided to whoever those stakeholders are so that they can have human in the loop, they can gather the information based on their information exchange requirements to help do that crisis response, again, at the local, operational, and strategic levels. And this shows, by doing it, the domestic and international partners, they'll be able to come in on this side to do two things. And what we're looking for is micro-tasking type technologies and collaboration technologies so that we can do mutual assessment and analysis in near real time. And the loop would just continue to loop, the observe, orient, decide, and act cycle to help us get ahead of the problem and not just looking at the status of the problem. So what I have here is on a smaller, very micro scale. We at the CDC over the last few years have been employing some of these enabling technologies, as well as from a material perspective, but also from a non-material perspective, process, procedures, and techniques. And let me go back one. What we have here, and they all are related to this area of collect, extract, convert, analyze, and visualize that we just took a look at. This is a case where the Ministry of Health on the left-hand side was putting out their cholera disease. It was in French, it was in a PDF, lockdown document. It was not in a really structured format for the scientists and the epidemiologists. We got with the scientists to establish their information exchange requirements, their algorithms, develop dashboards interactive with analytical charts, automated epidemiological charts, and as well as web pages to provide amplifying information. So by taking our informatics individuals, took and developed macros that basically took the XML code off the back of these documents, extracted it to access Excel and a SQL database, and then from the time we pushed the button, it drove every one of those data in one time, in a taking from unstructured to structured, and instantaneously all of those products for decision support are updated. In addition, when we do that SQL or we do the convert and translation, we sent it and we didn't have an ability, but we used Google collaboration groups during this event in order to all of those partners, some 90-something NGOs, non-government, as well as government and international partners. We put it out there and we provided that data to them to share. And not only that, we got their contact information, so where we had needs and where we had data needs, we asked for it, and then they started posting it, multi-directional on the site in order for us to do the next slide. And this is an example. Let's go to the, whoop. This is an example of where we use Google Earth, because we could use an open systems platform that's already web-enabled. We took that data that we had, but we also took the data from the partners, and we converted it into KML files. And in this case, we were looking at 4 major areas: environmental data, demographic data on people, disease indicator data, biosurveillance data, and critical infrastructure data. Those are the 4 major areas that you need in order to not only know what's going on, but do something about it. So in this case, right after the earthquake in Port-au-Prince, we knew where all the open areas were. And we just took satellite data, georectified, and put every soccer field, parking lot where the displaced populations would go. Some 1.4 million people are in where those purple people are. And within hours, we disseminated it, because people need to know and plan where those folks are. When cholera hit, the cholera information, that's a time and space temporal slider of where the first disease was located, and over time how it spread. And those little circles are the critical infrastructure, the oral rehydration, intravenous hydration, and the hospitals. On the bottom, you can see from the beginning to a couple of weeks to 6 months later, amplification data was collected to show changes at those dislocation camps to help planners determine needs or deficiencies. And so you can see how this multi-dissimilar data and the ability to dynamically, that white vertical line, were all different metadata layers associated with to prevent life and reduce mortality and morbidity. or protect life, not prevent life. Protect life and reduce mortality and morbidity. Here's cases where some of those folks on the Google collaboration group, they were providing infrastructure data. At the beginning, all of the road network was red and orange, but as debris was cleared, we could show day by day, it got better and better for folks that needed to know how to get from the port and the airport and get their supplies to those dislocated vulnerable populations. The river network for enteric disease, dengue, malaria associated with those people also helped the planning of which populations need netting, insecticide, that kind of thing because of known disease in the location. The bottom left-hand was an indication of unsafe water sources. After about 8 hours, people get real thirsty and will start drinking out of fountains and old wells and such, causing future disease. So we needed to map that as well as the vulnerable population with the critical infrastructure. Security information is very important. That's what's on the bottom right. This is where I'm going to stop. This should provide you with what we're talking about, and all of this information comes from all different sources. Again, gold standard, silver standard, and the bronze standard information, and the ability to use current technology to allow us to have this participatory crisis response, public health, information sharing, collaboration, and analysis, cooperative analysis capability to get ahead of the problem. So what I'm going to do now is I'm going to ask just a few questions that I scribbled down to our panelists. And I may not have to get through all of them because what I expect for all of you is that once we get into the discussion, many of you already have questions. And between the panelists and myself, we hope to learn from you and also answer your questions as well. So I'll start here with my colleague, Dr. Andreaitis. And I have here, from a public health perspective, what do you consider the most important need or capability to improve identification or characterization of a threat to the public?
So clearly, as Jim described a few minutes ago, what's really critical for us is to establish an evidence base that informs how we respond and what we need to do, how we deploy our assets and resources. If you just look at the last 10 years or so, you can see that it hasn't been a dull decade. We started with the anthrax events, we moved on to SARS, we also had the 2009 pandemic, Fukushima, and Superstorm Sandy, and many tornadoes and other things that I'm not mentioning that happened in between. And what's very clear about all these events is that they are really disrespectful of boundaries, geographical boundaries. And what they also share in common is the need, particularly at the earliest stages of events, to allow us to gather as much information as possible so we can figure out what is going on. These events are also critical because they present lots of problems. Usually there's disruption of healthcare services, loss of infrastructure, economic damage, and of course, most importantly, injury and death. And so our ability to mitigate the event is critical to prevent injury and death. As we look from a public health perspective, what are those critical information needs that we have? Well, the first is we need to figure out if we're actually looking at an event or not. Now, in some of those cases that I mentioned, it's very obvious. You either have an earthquake or you don't. In other cases, though, for instance, the flu pandemic, initially we see a blip or maybe a foodborne outbreak. We see some data that's indicative that maybe something is going on, but again, maybe not. And so we need to be able to make the decision, do we just continue to monitor this, or do we allocate resources and do a full-blown investigation? So CDC and other organizations work very closely with state and local jurisdictions. And the state and local jurisdictions have lost more than 40,000 workers, public health workers, in the last two years or so. They really do not have the financial resources due to budget crunches at the state, local, and federal level to be able to just easily send folks out into the field to gather this information. And so we really need new tools to help us look at our data, look at historical patterns, and help us to figure out whether, again, this is something that's indicative of something bigger, or whether this is something that we can just monitor for a while. Another key area that we consider is, what is the actual risk to the public? Are there certain members of the population that are particularly vulnerable? Elderly, children, as an example. What's the potential severity of the event? What is the scale of the event and the scale of the response that would be needed? And what is the timeline, whether it's flu or whether it's a natural disaster, where we have an opportunity to act and influence how it proceeds, the extent of injury and or death. Next is looking at medical countermeasures, or looking at our response. Do we need to identify and deliver pharmaceuticals, for example, if it's a disease? Do we need to deliver non-pharmaceutical interventions, so quarantine, recommendations to keep your kids home from school, and other things like that? So that's another important piece of what we need to do. And the last one is, once we deploy these interventions, how do we know how well they're working? Should we stop the intervention? So if it's a pharmaceutical, is it working? Should we stop? Should we modify what we're doing? Or should we continue doing exactly what we're doing? And so part of our challenge is, we have traditional mechanisms, these gold standard data sources that inform our processes. But this is a different age. It's a networked age. It's an age of big data. And the question we have is, how can we leverage these new technologies and new ideas and data sources that are not traditional to us, like data coming directly from the public and social media, to help inform what we do?
Yes.
So kind of building off that, one of the things I've heard like Pat Allen talk about the response to Hurricane Katrina, and the major lessons were, you don't have time to fool around. You have to be prepared to act. And the other was, you never know what kind of event's going to happen at what place at what time. So how do you see pre-staging this kind of capability? What would people need to do to not wait for it to happen? And especially when you know what incident team, what skill set is going to have to cope with it. And for all these different people together that just are well-intentioned, but they're not pre-trained, they're not equipped, how hard is it to tap the potential of this kind of an arrangement? What do you have to do to get the country ready to use that kind of capability?
Yeah, I think a couple of us will be able to answer that in different ways. But I think you're exactly right. I mean, it's not easy, and it's a transition moment. This is something that, in reality, in 2007, so everything you're saying is correct, but I think we can be very thoughtful about what information we ask of the public, what standards we need to put in place. But if you look at 2007 during the Colorado wildfires, that was really the first wake-up call that things are changing, and we need to figure out, so my answer is, the train is moving, it's left the station, and we need to really figure out quickly how we can utilize that unstructured information coming in from these other sources to help inform what we do. So in the Colorado wildfires, there was national level data, but people in the communities where the wildfires were actually taking place realized very quickly that the data and information they were getting was not relevant. Winds were changing, fire lines were changing, evacuation routes that were announced were actually not safe anymore. And people back in 2007 used Craigslist, they used Twitter, they used a variety of means. They were empowered and took control to share real data and information with people in their communities and in their neighborhoods. And that's the power of what we're trying to tap into.
Yeah.
I think,
Yes.
I think from a data perspective, I think there's also a real need to understand that you're not going to be able to prep anything coming in, and that we need to sort of move away from the idea of building something in advance. Something like a lot of analytics is situated with things like rule-based systems, or with learning systems, or with systems that need taxonomies or training. And I think right now, sort of moving into the commercial sphere, is a lot of people who have systems that don't require that kind of information. They require something that learns automatically. So that's going to be key, because when something happens, the vocabulary isn't going to be set ahead of time. What people are talking about isn't going to be set ahead of time. So it's really important to make sure that that would be number one, would be make sure that it's going to be able to learn, it's going to be able to keep up, it's going to be able to realize that these places, these locations are things and places, and to be able to adapt and connect those things together. The other real key here is usability. And of any kind of system that's being developed, and I know that's something you guys have spent a lot of time thinking about, is we don't know who's going to need to use the information. We don't know what their training's going to be. We don't know if they even have a background in data or in analytics, or if they're just somebody who needs to understand where people are going and where the water sources are. So making sure the technology is usable by people of a wide variety of backgrounds and whatever dashboards are developed really play into that is going to be really critical.
Yeah, we had a question.
The idea is to incorporate non-traditional data sources, for example, from social media. How do you filter out the inaccuracy of location? Twitter, for example, is notoriously inaccurate as far as location. So is Facebook. On Facebook right now, I'm supposedly in Croatia.
Yeah.
And secondly, how do you also account for panic? If the idea is to catch trends early on, how are you able, with any certainty, to say that these are genuine examples of an epidemic that's gathering force, as opposed to many people are reinforcing their fear?
Yeah, another great question. And there are a couple ways to answer that too. One is, as we're working with Twitter, we're figuring out, and other social media outlets, we're really in a process where we're figuring out how to do the analysis. So is it the person on the scene that's actually tweeting whatever the message is, or is it now someone that's halfway around the world that's just repeating it? So figuring out what the issues are, what the limitations of the data coming in is really important. The other piece that Jim and I think, really want to stress is this isn't just also looking at social media only and leaving all our gold standard surveillance data behind, but it's looking at how do we create a conversation, how do we share data so that we're taking the gold standard data and using it in some ways as one approach to verify what we're seeing coming in from the public and for other sources.
And I think, yeah, go ahead.
Thank you. If I could just add, I mean, this is a beginning of a process. You're hearing about products, right, that are being developed, and many government agencies have their own products that are linking into doing the same thing. We're talking about integrating everything, including empowering the public and encourage them to utilize this themselves. And so there's going to be a robust dialogue over the course of this coming year for all the different stakeholders to talk about these things, to explore those options. You all are going to be very important into helping inform that process so these products and this program can be best utilized. I mean, many people want to make a difference. They want to know how to volunteer responsibly and how to donate responsibly. That's some of the things we work with. But the agencies that are out there working in the private sector and in the government, fundamental to what they do is they need to have competent networks of relationships, and they need to have better situational awareness. Sometimes that's pre-positioning, but sometimes it's just getting the information ahead of time, knowing the people that are there that can make competent decisions. Those networks now can be empowered by this new aggregation of data and information, and then the public, who has a lot of responsibility. The average American has a responsibility to not only better prepare their families, their workplace and things, but they also give to their communities as well, besides preparing. This is a way to give and for them to be empowered where they can see, oh, the bridge is out and that tree knocked over the power line. That's why my power is out in my neighborhood. Okay, what can I do about it? And they're going to have all of this information. So I'm just using an example to personalize it. Of course, many of us are worried about catastrophic disasters. And so how do we go about doing that and then socializing this and then creating innovation so people can not only develop the products that are going on here, but then others can develop new products to better utilize this and make a more resilient nation?
Yeah, one of the things that you hit on, Dr. Havasi, whether you're talking criticality analysis, sentiment analysis, one of the most important things also is understanding who's tweeting. What's the relationship? Is it some viral message, or is it something that, it's a person or an agency that it has, stature and a lot of followers? And so, I know that, Catherine, you were about to say something along that, because that's a lot of what you at MIT have been doing.
Sure. Well, it's not just me and it's not just MIT. I think right now when you're talking about figuring out whether or not people are on the scene, there's some really great work that's being done right now at the University of Boulder And we have a great amount of data for this because we can look at the Arab Spring and we can look at the information that happened there. And if you look back at that, a lot of the information, a lot of people who were tweeting like they were in the scene were back in the UK. And they wanted to be part of something, they wanted to spread the word, maybe they wanted, I don't know why you would pretend to be somewhere you're not on social media. That's not what I do. I just try to figure out how to detect that. But there's a lot of things that actually link back not only into content, but into the analysis of networks. And if you see how people are connected together, you can sort of predict that. But again, I want to just echo what everybody else was saying is you never want to take one data source by itself. You want to be able to integrate things together because you can learn a lot from how, how different sources react.
So network analysis can maybe take care of location. How do you take care of panic?
Multiple data sources. Multiple data sources.
Google Earth, Google Food Trends has massive data sets.
Yep.
Yet they greatly overstated the last
Yep.
flu season. If Google can't do it,
Well, they can't do so it's like that example with Edison and the light bulb, right? He identified 499 ways of how, which maybe he said or didn't, but he identified 499 ways of how not to make a light bulb, which helped him figure out how to do it. So I think that's what we need to understand here is we don't have the magic answer, but it's a process. And what it's going to really require is that we try things, we're open about it, we learn, we reiterate, and evaluate it, and do it again.
To quickly answer that, Google is looking, and then I know there's a lot of things, so I'll be very quick. Google is looking at search queries, and when people search for something, it's not necessarily because they're affected by it, it's because they're worried about it. So the Google search query thing is going to amplify the panic a lot.
Yeah, we had a question back here, and then we'll get yours.
It strikes me that some form of accreditation model to actually certify that the sources, your information sources within your network that are more formal could be used in the preparation cycle. And then as they're accredited and certified, that metadata can be added to their systems so that you know you're getting a certain quality standard for
Right.
data submission. Do you find perhaps with things like Twitter that's not accredited and it's in wild information? But you might have trained professionals in various organizations that utilize systems and they've been accredited, there's a certificate attached to the metadata, and it flows into your systems with a certain quality standard. And you can use that to judge what you see in the wild. Is that mechanism in place? Do you use that? Is there other providers?
I can answer some of that. It's, at least on some of the federal side, the NEAM project, the National Information Exchange Model with the gold standard providers amongst many of you may be in here. The process is to define, not data models, but to define entities and attributes of data and what quality, resolution, or accuracy is in that database so that we all know what each and everybody's providing, and we are aware in those different data repositories, they are identified, we know where they are, and we know what we can use to meet our information exchange requirements. That's one of the really great ones that I've seen recently that's going to help with what you're talking about. Unfortunately, when you go into the silver and the bronze standard, the social media, the stuff that was in the top right-hand corner, there is no real structured way to accredit the information. So we have to have off-board systems. We have to have technologies like semantic analysis, network analysis, different ways to mine that data to get to how can we verify relevant information when compared with the other databases.
Yeah,
Absolutely.
And actually, I think that's the opportunity with this program. It's to start building those new partnerships between us and the public. So for example, Jim mentioned microtasking, and there's also microseeding, right? And the development of an app community. So let's say we create apps that help us to, because it's not, we just don't want any and all information, but sometimes we're really after something very specific, or sometimes the public needs something very specific for their needs. And so it's this kind of multi-directional sharing of information. So for example, we may develop apps that are very specific. So for Superstorm Sandy, at a particular area, we know that we're afraid that there's damage and whatnot, and we want to know some subset of information. Through an app asking specific survey questions or however we want to standardize and structure it, we may be able to get people to provide that to us. We might also use something like crowd seeding, where we can actually train people as part of this virtual workforce to, during events, as part of your community service or goodwill, to come and help us to do that. So I think there's opportunities like that.
Yeah, because you know that one of the interesting things is, like what you're talking about, this isn't like, oh, this is existing. We're talking about what's going to be coming here very soon, okay? And how is everybody going to be utilizing that? What's going to happen? What are you all going to do to contribute to this in this country? Even within the VOAD network that we have of all of these agencies, these are very diverse, just representing the communities of the country. It's most of the faith-based organizations in America are part of this. They have very diverse cultures. They're all coming together in protocols to share information. We've just agreed to create what they call VOADnet. So this is how this sector is going to be embracing this. We've gotten private sector companies like VisionLink, Google, Salesforce, and Palantir have all contributed in kind to create a product, a VisionLink, that is going to create an information sharing system where they can empower technology to be able to geomap what's going on, even in real time, and overlay it with all the public source data that's available. Well, they're getting ready to do this there, this community, and in the coming year, they're going to be able to link that with what's going to be coming through the Operation Dragonfire too. That's going to, and those are people that go into every one of your communities. They go into your churches, they go into your community centers, and they go into the volunteers like AmeriCorps and all of that. And so this is something that we're trying to do to encourage that sector. And so we think there's going to be a lot of emerging applications that are going to come, and hopefully you all will create some of that innovation too.
We had a question here.
Yeah, so are there plans or current activity to integrate the different UAV platforms into this?
Yeah, remote sensing, and I'll let the others, we have been doing a lot of work on different remote sensing capabilities, not only on UAV platforms with multispectral type imagery, MASENT, SIGINT. A lot of that has, the military is the best to say, if they can find blue and red order of battle and find out attributes on the entities that they're targeting, disease and vulnerable population and critical infrastructure is the same thing. Data's data. And the ability to use those type of remote sensing technologies are huge, which we're looking at. That's going to be part of the technology group, the governance structure starting this year to go out, canvass the organizations, the stakeholders, the technology partners, and say, what is out there that we don't know about in this realm that you talk about, and how can we apply that as part of that data set in order to then correlate and fuse with the information that we've been talking about? Very good question. Yeah.
Given Red Cross's digital ops capability, how do you see
Yeah.
your process connecting to how the federal and local governmental organizations are now going to be doing disaster response?
I don't know yet. I think, one of the things we've been talking about a lot over the course of the last 24 hours and in general is this, strength of big data and visualization and really aggregating all of the information in all of the world, no matter its merits or standards. And I think as human beings, we have a very innate desire for that big picture of exactly what's going on. And I think, for us, I have no doubt that we're going to get there, and we are going to be able to take great advantage for situational awareness and even knowledge and intelligence of this big data. But I also think it's really important to think about how we might lean into the strength of decentralized little bits of data, all over the country or the world as that's happening. And I think that's one of the big challenges for us. Everybody who comes into the DigiDoc says, how can we share this information? And the truth is, it's not very easy to do, and it's, we're using proprietary software. So one of the things that will happen, I have no doubt, over the next couple of years is that there will be open source solutions for this, that we can actually have a common data standard and that we will be able to see what one another sees, and that can be shared across local, federal, or local, state, federal levels of emergency managers around the country. But they also have very different purposes, and so it's really about defining, you know, exactly what is it that you need in order to make the best decisions for your community, or what kinds of data do you need to know to inspire your community to be more resilient. And so I'm not personally moving in the direction of how can we figure out how to make the entire world a digidoc that we're all looking at so much, but what are the strengths in those little bits of data for hyperlocal responses, for home fires, for the beginnings of public health outbreaks, that kind of thing.
Do we have anybody else that wanted a question? Because I had one. I had one for Dr. Havasi. It's in the area of computational linguistics, and based on what we heard last night in the keynote speech. From your perspective, what supporting technologies, some of which may be out here in this group, is most needed to achieve the desired outcome to support semantic analysis?
Well, I think always it's about getting the data in the first place. And I know people here started out talking and criticizing social, and definitely there are ways and alternatives to do that. I think building an infrastructure where people are able to submit, people are able to talk about what they're experiencing in a way that's, I want to report this, I think this is important. And at that point in time, people will place a little bit more emphasis on that and a little bit more emphasis on accuracy. I think building an infrastructure for people to talk back to us is really important. I think that's very, very critical. I think the other thing that happens is that there needs to be a little bit deeper of an understanding of data. Everybody's really big hurry to take data and put it and make things work with data. And I think we've seen a lot of people who try to apply data to situations where it's not necessarily helpful, and apply the wrong data and ask the wrong questions to the wrong data. So just because you have data doesn't mean you shouldn't start out with data and then try to find questions. You should start out with questions and then try to find data. So I think that sort of education, that sort of mind shift needs to happen, because I think a lot of people are looking at the data that they have and they say, oh wow, I have a lot of data, I need to do something with it. The answer should be, the problem should be, I have a lot of questions, how can I look to my data?
Right. I think that's a perfect place to close it. What you just said pretty much supported what everybody just said, and why we're trying to come up with this cooperative, participatory capacity using today's technology. Again, I'd like to thank every one of you for participating, and hopefully as we move down this path, some of you will be part of the stakeholders to help us achieve this capacity and capability. Thanks a lot.
Thank you.